Oh!
Good. Let it go.
Oh!
Good. Sinking in with the hip scalp.
Oh. My spine, I've noticed over the years that I always get like these lower back pains, and I know that a lot of doctors told me I needed core muscle to support my upper body weight because I'm very thin, but I also have a lot of upper body weight. So that has caused a lot of like tension on my spine. So I don't really know what I have to do prolonged period of time because that will become an issue as I get older. Now I'm just dealing with the pain.
So you've had it looked at by medical doctors. Did they send you to PT or?
No, they said that there was nothing visually wrong with it.
They took X-rays.
They would like do like the exterior, like
motion.
they would like look and have me like do all the bends and like check to see if there was anything displacements or like abnormalities, and there was like nothing visually that they could see. As far as I can recall, they never did any X-rays. They just more or less said you should probably improve your muscle mass to help with that problem, but I never considered going to seeing somebody about it.
Have you ever had any pain that goes down your legs at all?
Not necessarily like regularly. I mean, sometimes they'll get achy, crampy, whatever.
Right, so I have for the upper back neck positioning. Have you ever had any pain that goes down your arms?
Yeah, more or less. I think it has a lot to do with like the tension on my spine, the posture, because sometimes I catch myself like slouching and whatever, and I know that is not helping my case with my spine. But I try to always catch myself with my posture, and even sometimes that's when the pain will come in, is like if I have been slouching for a while and then I try to force the posture, and that's when it will usually come.
Okay. All right, very good. Do you get headaches ever?
A lot.
A lot. Okay. 2 a week, 5 a week, 2 a day.
I would say maybe like 2 a week would be like the ratio, how much it actually happens.
All right, so 2 a week. So we're past the hormonal stage at this point. It's not once a month with your. Are they affected by your period? Do they increase?
Yeah, I actually don't get any with my period.
Okay, very good. And then, do you notice anything else with it, like water intake or lack or blood glucose level, blood sugar levels? Not eating.
Those seem to be fine. Because I eat a lot. Normally when I have a headache, I will like overextend and eat a ton because I don't want to feed it with caffeine, because I used to be very dependent on caffeine, but the only thing I liked to have with caffeine was soda.
If this were a comedy channel, like this is where I would go get my coffee, and like I would cut in like when you're like, I'm not dependent on caffeine, I'd be like, I know, excuse me.
Excuse one second. Well, I'm getting tired.
So when you get a headache, where on your head does it hurt?
Usually around like my temple area. Okay. That's like
both sides
mainly
equally?
where it is.
One side more than the other?
They'll take turns, basically.
Do you have sensitivity of light? Not really. So
like
nausea?
Normally, like nausea is a big problem for me.
Okay. Like with and without the headaches, or just with the headaches?
Nausea will come with the headaches, but then there's a lot of things that I know make me nauseous. So when it reoccurs, like I know I'm gonna be, I just kind of take action to make sure that, because like riding in cars, if I'm not driving, that gives me a headache, and then it brings on the nausea.
You take any pharmaceutical medications?
No, right now I only take vitamins, like regular vitamins every day, and then naproxen sodium for pain.
Oh, I just wasted my finger crack. All right, I'm going to start off with a very gentle scan on the top of your spine, okay?
All right.
I'm going to do a temperature evaluation with the back of my fingers. Very warm, very symmetrical. At the sacrum, the temperature drops off here. We're working a little bit harder on the right side. Up in the shoulder area here especially. T1, T2. And I feel like this is going to be a primary area to adjust already. You may have just like a slight little like postural curve, like you're leaning just a little bit to the right. We'll see if we can accentuate that. It just might be a seated posture. But overall, your muscle tone is very symmetrical, and it's good. Yeah, it definitely has some tension in that guy.
I feel it.
Not as much, no more right, left.
Right.
Yep. Yep. That one here. Okay, I'm going to palpate your SI joints. Do you have any tenderness here?
A little bit, yeah.
Here, left side, left SI.
Actually more prominent on the left.
More prominent on the left. I'm pushing into your lumbar spine here. Do you have any pain, discomfort, tension?
Nope.
L4, pain, discomfort, tension.
Nope.
3, here.
A little bit.
Working it up here, upper lumbar here.
Yeah.
Got a transitional here.
Mm-hmm.
Okay, let's
Yeah,
keep going.
it's like increasing.
How about now? Still increasing?
It's not as bad as the last.
Got one more.
Yeah, not there.
And what you're going to do is move your knees apart from each other.
Mm-hmm.
Go ahead and open, close, open, close. Good. I'm getting good dropping on the right. Just the right. Close. Just the right. Good. Just the right. Close. Now just the left. Good. Just the left. Good. Less movement on the left, but it's there. Thanks, Dr. Rahim. He showed me that one. You have a little bit of stiffness in here, but it's not terrible. I mean, this is a very common stiffness, never been adjusted before. Do you stretch at all?
Very seldomly, not as often as I really should.
Okay. The more you stretch. The more you stretch, the less you need me.
Mm-hmm.
Okay, let's do this. Go look up at the ceiling. Now chin to your chest. Good. Ceiling. Ooh. Does your neck crack by itself?
No.
Good. Look up. Down. Right neutral. Let's do right ear. Slowly right ear down to your shoulder. Good movement in the transition area there. Good. Now go to the left. Just discomfort that side. See your shoulder compensating. Right shoulder comes up there.
It doesn't feel bad though. It's just like.
What does this feel like compared to this?
Right feels better.
Going to the right feels better.
Yeah.
And you feel that little bubble like underneath my finger, like popping around
Mm-hmm.
on the left side of the spine here. So lower left cervical spine. Pain?
No.
Pain?
Yes.
Right, Alice. All right, so I'm going to check the glute fibers. This tells us which way the pelvis is moving. Okay, I'm going to check the glute fibers. So you're going to feel my fingers on the back of your hamstrings, okay?
All right.
All right, so from the hamstrings, we're tracing up to the bottom of the glute fold, and we're lower on the left, which is not as common as lower on the right. So lower on the left, I'm looking from the top. We have an external rotation on the left. So that means that's telling me that your left pelvis has gone backwards and out, and your right pelvis has gone forward and in, possibly. We have to double check these when you're laying down on your belly. Looking for any curvatures. There's no rib humping here. Very symmetrical. Let your head relax. But still just a little bit more prominent here in this upper thoracic, for sure. Small little sways. You feel that though? You just came back?
I feel it. It's just like, it's so normal.
It is normal, yeah. You're supposed to do this. This is telling us what's going on in your pelvis. Looks like mostly front to back. I don't see a whole lot of lateral. There's a little bit of lateral sway there. Your body quickly compensates and stabilizes. There's a little bit more. It wants to go to the left. You want to sway to the left for sure. But more to the A to P, to the front and back. Okay, that's fine. Okay, looking at the feet first. Heel strike, mid stance, toe off. Looks symmetrical bilaterally. Good. Turn around and go the other way. I don't see any inversion, eversion. There is pronation on the left side more prominently, slight pronation on the right. We'll check the Achilles tendon on the way back. High shoulder on the right, apparent at the level of the hand as well as the shoulder. Good. This angle looks more prominent to the right and restricted to the left, and then turn around and go the other way. I'm looking from this side. It looks more symmetrical from the back, but from the front it's swinging to the right more so than the left. So the pronation is bilateral, and then slightly more on the left. I'm going to touch the bottom of your feet, okay?
Alright.
And that's okay, just leave your foot down. Here, make a little space here, though. Good. And then arches are intact on both sides. Alright, so the left does show up as short first. That matches the standing glute test. I'm going to push into your sacrum here, okay?
Alright.
Do you have any discomfort, tension when I push here?
No.
That's good. Left side, discomfort, tension.
Mm-mm.
A little bit of a spasm in your glute muscle there. How about there?
When you press harder, yeah.
Okay, L5, any tension, discomfort?
No.
L4, tension, discomfort.
Discomfort.
3, tension, discomfort.
Discomfort still.
Okay, a little bit more. This is where we started to find it on this seated exam. How does this feel? Tension?
Yeah.
Discomfort?
More tension than anything.
Okay. Okay, if I push here, do you feel it more on the right or left?
The right.
Right or left?
Right.
Left or right? Left.
The left is like more uncomfortable.
Okay. And like, do you have tension here?
Yeah.
How about here?
Yeah. But more on the left.
Okay. All right, let's do this. Lift your right leg up in the air. Down. Lift your left leg up in the air. Down. Okay, that's good. That's even. Okay, let your back relax. One more time. Right. Down. Left. Down. Good. Left short stays short. Points to the right SI joint. Left short. Stays short. Right AS. I don't believe it. I think it's actually the left SI joint, not the right. Is this tender?
Yeah.
Is this tender?
Mm-hmm.
I could be wrong though.
Oh, yeah. Ow.
Alright, so I'm going to adjust your sacrum on both sides. This. Okay, just relax. Let me do the work here. I'm going to lift up your hip. Good, down. Good, right hip up like this. Good, down. Okay, do you still feel that tension, discomfort here, or does it feel the same or different?
It feels different.
How?
There isn't as much pain, I guess.
Tender?
Mm-hmm.
Terrible?
Yeah.
Nice gentle breathing. We're just going to do a stretch. Nice gentle breathing. I'm going to follow your breath with my hands. Let's practice. You're going to breathe in. Then as you breathe out, I'm going to follow your breath with my hands. Let it go. Good. Let your shoulders go. Good. Just like that. It's perfect. Then when we get to the end of that breath, we just push like that, okay? Okay. We're going to start in the middle, and then I'm going to work my way up to here, okay?
Okay.
Okay. Very gentle. Good. Nice and gentle breathing in through your nose. Following with the shoulders. Sing. Good. Okay, a little bit of it. Okay, let's try again. Deep breath in. And out. Shoulders relax, sinking in. Let the shoulders go. Let it go.
Oh. Oh, yeah. Felt that one.
That was good. I'm going to lower the headpiece down just a little bit.
Okay. The first of many.
Okay, now coming to the top of the spine here. Good. Okay, same thing. Breathing in and out. Good. Sinking, sink.
Oh.
That was really good, Alexis.
Yeah, I felt that. Oh my gosh.
Like this is that lower cervical thoracic transition right here where I said it was prominent and sticking out, and it adjusted perfectly, exactly the way that it needed to. Okay, one more at the lower. Now, see, this is going to be just as important. This is the transition between the thoracic and the lumbar spine. Then as you breathe out from there, let your shoulders go. Good. We push at the top of the breath this time, okay?
All right.
We may have to do this one on the other side. It's pretty close to an anterior, but let's just try this one first. Deep breath in, far as you can go. Now let your shoulders drop as you breathe out. Good. This time try to breathe in without your shoulders. Just breathe in. Slowly, softly. Shoulders relaxed. Breathe out. Alright, so for this one, Alexis, you're going to breathe in, and then as you breathe out, we're going to lean back together, okay?
All right.
Okay, deep breath in. Lean back as you breathe out. Breathe. Good. One more. Keep breathing. Yep. Okay, that was pretty good.
Yeah.
Okay, sit nice and straight. Breathe as you lean back. Breathe, breathe, breathe. Okay, relax. Okay, Alexis. Okay, so the bottom leg is straight, and we're going to bend the top leg like this. Good, and I'm going to scoot you forward just a little bit like this. I'm going to pull the shoulders forward just a little bit like this. Good. Okay, so this is you're going to be at this position on the table. Good. You're going to turn your head so you're facing the window. All right, so you're breathing. Good. I'm bringing this down. We're going to push backwards like this. Okay, breathing in and out. Good. Bring this down. Good. A little bit more. Good. One more breath. Let that out. Good. Sinking in. Let the hips go.
Oh.
Okay, lay on your back.
I feel like I have a commentating sound for every single one. It's just like
One is the same adjustment. Okay, you're going to breathe. As you breathe out, I'm going to bring your shoulders this way and your hips down. Good. Sinking breathing. Let the hips relax as you breathe. Good.
Oh.
Lay on your back.
Oh. That one.
God, what?
Those ones felt good. All right.
All right, bring your right ear down to your shoulder. Okay, now back to center, and left ear down to your shoulder. Good, back to center. So remember when you were seated on the table, it felt better to go to which side? It felt better to go to the right.
Mm-hmm.
So what does it feel like now?
Yeah, it feels better to go to the right.
Okay. All right, so when you go to the right, that makes your legs less even.
Really?
Yep, they become more uneven when you do that. Now go back. And so now go to the left. Okay, there's the restriction. But when you go that way, your legs get more equal. So even though you have the mechanical restriction there, going to the left, neurologically, it's telling me that that's the way your neck wants to move. So we're going to adjust the lower left cervical. Now turn your head to the left. That also shortens the difference between your legs. It doesn't equal them, but it shortens the difference back to center. And then they get more unequal again when you go back. So that's telling me that the upper cervical spine wants to move to the left. So we'll adjust Atlas or C1, C2, occiput C1, C2 on the right, lower cervical on the left. Let your neck and shoulders relax. That's good. Nice and gentle. You can close your eyes. Just relax. Nice gentle breathing. Your head and do a range of motion here. Just let your head relax and shoulders relax. That's good. Go let your head relax and just let me move your head. You ready to get your neck adjusted?
Am I?
Start on the right side. This is what it feels like. I'm going to bring your head over to like right about here. And then from here, just using my hands, you can let this relax here, let this relax here. Using my hands, I'm like feeling your neck and coming this way. And then as you're breathing, the only thing that you need to do is just like let your head drop into the table. Okay, let it drop like that. And then as you breathe, we're just like finding where it's stuck. For you, it's C0, C1 right here. Then right from there, we're just going to push just like that, okay? Okay, gentle, 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 gentle. I'm not going to push super hard, okay? And all you have to do is as you breathe out, just let your head drop like this. You're doing good. You're nice and relaxed. So let's try a breath. Let's just practice. Deep breath in. And out. Absolutely perfect. Let's do that again. And
Oh, wow.
okay, nice and gentle. Breathing, shoulders. Good. Good. 7, 6, 5. 7, 6, 5. Good. Breathing. Good. This is actually a little bit higher up. 4 and 5. Good. We're going to let this relax. Loosey goose. Good. 7, 6, 5. Not counting down. I'm just counting where it go.
Look, he's not getting to 3.
Okay, cool. That one. Okay, let this relax here and just sink in. Good. Let it go. Good. Let it go.
Whew. I was not expecting that. Let's take it.
Let your foot relax. Let your foot relax. Let it go. Let it go.
Oh. Sorry, I left it pain.
On the left, right big toe.
No, just in general.
Okay, I'm going to adjust your ankles now. Like this. Let your shoulders relax. Good. Good. One more. Let it go. Let this relax. Let it go. Let it go. Let it go. Good. Don't fight it. Don't resist it. Just let me do it. Okay? Don't pull against me. Don't try to help me. Just let it go. Loosey goosey. Let it go. Let it go. Okay, one more. Let's see if I can get this one here. That was good. You did perfect. Twice. Digestive organ manipulation. So finding the belly button here. ASIS. We connect these 2 points. Try to let your belly relax a little bit. Hopefully there's more curls. Tender?
A little bit, but not like super uncomfortable.
Okay. This is the pyloric sphincter, is where the stomach empties into the small intestine. Yours is clear, so you haven't eaten anytime recently, right? Or did you probably eat on the way here, right?
Like little snacks, yeah, but nothing that would be too bad for this.
Okay, this is the diaphragm maneuver. It's terrible or what?
I mean,
Doesn't feel like it's great. Now breathe through your belly. Good. Breathe into your belly. Oh, no, you're breathing into your chest. Lift your belly up. Fill your belly with air. Don't lift it physically. No, you're reverse breathing. Let your back relax. Let your back relax. When you breathe, push your belly out.
okay.
Yeah.
I've never heard somebody tell me to breathe into my belly. That's why I was like, wait, what do you mean? Okay.
And you were just there you go. Breathe into your belly and your belly fills up. Good. Now breathe out and pull your belly back in. Breathe into your belly. Breathe out. Good. Breathe into your belly. Good. And breathe out towards your spine. There you go. Breathe into your belly. Out towards your back is what I should say. Good. Good. Keep going. Belly breathing. Keep going. It's terrible, right?
Yeah.
It's stuck here. Do you feel those little bubbles underneath my fingers too?
I don't feel them, but something feels bad.
Okay. Okay, we're just going to work this out just a little bit more. Keep breathing.
Ooh. I don't know whether it tickles or hurts more.
I'm sure it doesn't feel great.
No, not at all. It's kind of like a torture mechanism.
All right, ready? Squeeze. Good. Okay, let this relax. Let this relax. Left shoulders looking forward. Good. Good. Ah, so close. Push your elbow back. Push your elbow back. Push. There you go. Push. Okay, let your arms relax. Bring your chin down to your chest. I'm going to reach around the front here, lean forward just a little bit. We're going to come up like this. Let this relax loose. One more time, let the shoulder go. Let it go. Let it go. Go, let this relax. Good. Relax. This like this. Good. So the pins keep your hips in place. Your arms are good right there. I'm going to use this towel to support your cervical spine like this. Okay, you're breathing just like the other adjustments. As you breathe out, I'm going to follow that breath, and at the end, we're going to pull in that direction like that, okay?
Great.
Okay, you're okay with the towel?
Mm-hmm.
Okay, you can close your eyes, nothing to look at. Take a deep breath in. And out. Good breathing. We're going to do one more breath like that, and just sink in. Good, one more. Out. Good. Just let it come out. Don't push it out. Just breathe.
Oh, goodness gracious. Wow.
That was crazy good. You feel it all the way down?
Oh, yeah. You're getting the authentic reactions here. I feel like I just got an inch taller. I mean, my neck does feel way better.
Okay, good. All right, stand up. Walk around. Take you for a test drive a little bit.
Yeah, it's like I just got a new car. Wow. Yeah, I feel that. Oh my gosh. Whew. Feels nice. Feels better than what it was before, that's for sure.
Making your chiropractic adjustments last longer comes down to drinking lots of water, waking up in the morning and stretching, and then taking care of your posture. Good. Nice and relaxed here.
Ooh.
Tender?
No.
No, that was terrible. Hold on.
There you go.
So, this is a pulse reading from Ayurvedic medicine and also traditional Chinese medicine. Combine the two. Let this relax right here. So, this isn't like Western medicine pulse reading where they just measure one pulse rate, rate, rhythm, contour, and amplitude for heart health. This is a 3-point system and a superficial and a deep. And each point on the superficial and deep represents a meridian and an organ system. So if so on the superficial level, we have the large intestine, and then the stomach, and then the adrenal gland and thyroid. And then on the deep level, we have the lung here, and then we have the spleen, and then the reproductive organs. Okay, left side is gallbladder, urinary bladder, small intestine. And then on the deep level, kidney, liver, and heart. So let's go back to the heart. What does that feel like to you? Fast, fluttery, loss of breath?
The issue that I've had with it has been fast.
So you get heart palpitations, you feel it in your chest.
Mm-hmm.
Do you feel anxious before that happens?
No, it usually only ever happens after I nap. Or during my napping. That's the only time it happens.
It's fascinating. Do you eat before you nap?
Yeah, and as soon as I wake up.
Okay. So if I were to combine a couple things that I'm feeling with your adrenal gland on the other side and why I asked you if you felt fatigued, and then also what was happening digging underneath of your liver, and where you were all not, it wasn't your liver, but it was technically underneath your liver, but in your diaphragm on the liver side. It feels like it's not like a rapid heartbeat, but it's more like a heartburn almost. Like you're eating and then you're laying down, and that puts a lot of pressure on the top of the stomach. And so you're getting irritation. That's why when you get heartburn, it's a digestive thing, but it hurts over your heart. It's like referred pain.
Mm-hmm.
Your body doesn't like register pain exactly in the body where it's at. Like when it's internal, like you can feel that and you know it's on your thumb.
Mm-hmm.
But when it's your heart, your liver, your kidney, that kind of stuff, your body's like, where is that? You know what I mean? The pain perception of it isn't quite as accurate.
Mm-hmm.
So it feels like not your heart, but your stomach. Don't eat before you go to take a nap. Don't eat and then lay down is the moral of the story.
Mm-hmm.
We'll see if that changes anything with your heart, okay?
Mm-hmm.
How often does that happen?
It has happened every single time I've ever napped, honestly.